Some call it a frequency. I say it's a family. So with that, I'll give you some joy. .7 FM. One of my favorite anthems from way back. DJ days, huh? Joy by Odyssey. I think it was 1987, eh? If you know it, then they don't have your parts in Kokompe. Right, we have fun. We still get it done. We're on our diabetes drive on Ultimate Health Joy 99.7 FM. Yeah. Know your risk, know your response. And folks, look, I need you to join me to thank Dr. Chris Adai for joining us. Last week he ran into a bit of bad luck shortly after the program, but he insists on being Stubborn Academy. He's here today. Yeah, so I'm with Dr. Chris Adai, Senior Physician Specialist. Next to him, another physician specialist with the Kolebu Teaching Hospital, Dr. Beatrice Kisiwa Baye. She's with the Kolebu Teaching Hospital. We're going back into the diabetes demystification. You must remember what we did last week. We learned what it was. Problem with your body's ability to break down, process foods you eat, and unlock the cell doors for glucose. We'll do a retake on that, but if you have any questions, concerns, experiences, share them with me. WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. The program is Ultimate Health. With me, Nortey by Nature. Docs, you're most welcome.
Thank you very much.
Nortey. Uncle Chris.
Yes, Nortey.
Charlie, thanks for being here. Last week was there was a bit of bad news. but you're in one piece and you're here.
Sure. Sure.
And that commitment, dedication to inform and transform. So I don't want to give the details out there, but you and I know. Yeah. And Beatrice, Dr. Baye.
Yes, please.
Okay. Have you been on Ultimate Health before?
This is my first time.
Oh, have my sympathy. Where have you been? Are you dodging me?
No, not at all.
All right. Okay. So, Chris, let me start with you, before I baptize her. But last week we understood, and all my listeners who were with us last week in class should understand the basics of diabetes. Okay, a metabolic disorder with what? Some problem, some compromised function of the body, right? So can we just break that down quickly? Insulin, pancreas, type 1, type 2, just zap.
Okay.
Yeah.
Okay. So in very simple terms, the last time I said that when we eat the different classes of foods,
right?
So we have carbohydrates, we have fats, and then we have protein.
Okay.
And we'll focus on the carbohydrates.
Right.
When you break down carbohydrates, whether it is your banku, your fufu, your cake, or whatever,
okay,
ultimately, just like Ultimate Health, you get glucose, which is which is the final product. Okay. And this glucose that is then absorbed into the blood has to be distributed to all cells of the body.
Okay.
The cells are just the building blocks of the body. And you need a chemical or a hormone that should do this job by unlocking the doors of the cells and allowing the glucose to go into the cells to be used to produce energy.
Okay.
And that is where the problem sets in with diabetes. So you are not producing enough of this hormone, which we call insulin.
Okay.
The factory is the pancreas.
Right.
Or what you are producing is not enough.
Right.
So basically this is what happens. And if you are not producing anything at all, we say you have type 1 diabetes.
Okay.
And if you are not producing enough, or what you are producing is not effective, then we say you have type 2.
Type 2.
That's the basic underlying problem in diabetes.
Okay. Just joined us 15 minutes. Yes, we've been in business for about 15 minutes. We played some music and all that. But now, hey, we're focused. Diabetes awareness. Know your risk, know your response. We went through telltale signs and symptoms. We went through what would be a conclusive, emphatic clinical diagnosis, right? It's not that we are talking area and all those songs and all those things, but we want to know how it comes to be that you are conclusively diagnosed with diabetes, all right? Then we went through the signs, symptoms, and we'll look at some of them: thirst, unexplained weight loss, We'll go through that. But the most critical thing we want you to be doing is to be applying it to yourself, your family, and persons around you. What Dr. Adai has just shared shows that when you eat, normally, typically, it will be broken down. It must be broken down, okay? It's not just what it looks like or what it costs on the menu, right? It's broken down, and it's to nourish your body and to provide your body with the nutrients, the energy it needs to function normally, right? So we learned last week also that when you eat, normally, typically, there will be a rise in blood sugar. That's normal, okay? And you may remember that last week we went into fasting blood sugar, random blood. We'll get into all those. But hey, please, if you are a student of Ultimate Health, Sundays we don't joke. We didn't come here to play. So, Dr. Baye, let me ask you. So, okay, these two types exist, right? And last week we brushed through gestational diabetes and all of those. But we went into signs and symptoms. And again, if you could help us, thirst and all those things, what are the critical or telltale flags that we should look out for?
Okay. So first of all, I want to say good afternoon to your listeners. I think Dr. Adai went through a bit of that last week.
Okay.
So I'll just repeat what he said.
Okay.
Usually patients with diabetes, some patients are not usually asymptomatic. They might not come with any symptoms. But those who usually come with symptoms, they might come with weight loss. Then also you see that you'll be urinating a lot in terms of volume.
Okay.
Then usually at night, you and I, we usually wake up like once or twice to urinate, but they end up urinating a lot. Then they are usually thirsty as well.
Okay.
You can have a lot of infections, especially females, you are having vaginal discharge.
Okay.
Then also the issue with your kidneys. When usually they have the problem with the kidneys, they can also come with early morning facial puffiness, like when they wake up, their face is puffy.
Okay.
Then with time, your urine volume will start reducing.
Okay.
They can come with that as well. Then you can have blurred vision as well. And I think last week, Dr. Adai went into details with that.
Okay. Blurred vision, you increase the font size on your WhatsApp and your phone and all that. You're adjusting how you hold the phone. It could be that maybe there's a disease process underlying all these changes and challenges you're having. So it's important to have them checked, all right? So these are telltale signs and symptoms, but again, they are appraised, evaluated by a qualified professional. Okay, you don't just say, oh, well, I listened to Nortey and Chris and Beatrice last week, so I have diabetes. I'm already buying the things I need and I'm treating myself, okay? Right, let me stick with you, Dr. Baye. I mean, so... all right, these are signs and symptoms. I come to you, we have a chat or a consultation, an examination. You evaluate these things. But what constitutes a conclusive diagnosis? How will I know, and how will the doctor arrive at a conclusive, emphatic diagnosis that I am diabetic? Because a lot of people say, well, I hear it's in my family, they say this, that. Obian can't try me say, me not. Me what diabetes. What is a conclusive diagnosis?
Okay, so when you come to the hospital, usually we do a test called fasting blood sugar.
Okay.
You need 2 of that. And you need those values to be abnormal. Usually when it's above 7.
2
of the
abnormally high
fasting blood sugar.
Right.
And the fasting, usually you should have fasted for at least 8 hours.
At least 8 hours. You haven't taken any food.
Yes.
Right?
Yes.
That will be responsible for the rise. Okay, so your body, your system has been at rest when it comes to taking in food and processing it.
Yes.
8 hours minimum.
Yes.
Okay. When you say 2 of those elevated fasting blood sugar scores, right? 2 in the same day, 2 after 2 weeks. What does it mean?
Oh, you can. On the same day, you can't do fasting on the same day.
Okay.
So maybe today you woke up, you did your fasting sugar, it is high.
Okay.
The following day, you repeat it and it's high. Then you can conclude that indeed you are diabetic.
Okay. Right. I am the life president of the Stubborn Academy. Chris, this high business, what is high? We talked about the American system and the other system, right, which use more or less the single digits, right? What is the cutoff for high blood sugar?
Okay, so just like Dr. Baye has said, we normally use the millimole per liter.
Okay.
Okay, and the normal fasting blood sugar is 4 to 6 millimole per liter.
4 to 6.
Yes, that's normal.
Right.
And then when it is above 7 millimole per liter,
okay,
we say that you have diabetes. So you notice that between 6 and 7 there is a range. We call that one pre-diabetes. Okay, so that is for the millimole per liter, which we use over here and then most of the rest of the world use.
Okay.
But the Americans have a different unit. So that's why you see those big values. They use milligram per deciliter.
Okay.
Okay.
Right.
But it's very easy. If your machine gives you milligram per deciliter, just divide it by 18. And then you would get the value that we all speak with. So that when we say the 7 and the 6 and the 8 and the 10, we are all using the same units.
Above 7 or beyond?
Yes, 7 and above.
Is high?
Yes.
Okay. So if I have 7,
and you repeat another time and it is still above 7, you have diabetes.
You know, it's like the elections, 50 plus 1.
Exactly.
So if I score 7,
yes,
doc, I didn't cross 7 twice. Am I diabetic?
I said 7 and above, so 7 is inclusive. Yes.
Okay. So those of you hard of hearing, stubborn, willy skin, willy tway, please, these are serious numbers because we're going to use it to maybe direct you on what you should be doing. Okay. So pre-diabetes, I'm between 6 and 7. Right. Should I be worried?
Yes, you should. But the good news is that you can come back to the normal. I always use this example of between Ghana and Togo or between Ghana and Cote d'Ivoire.
All right.
You know, there's a place they call No Man's Land. Okay, so when you are there, you are neither in Togo nor in Ghana.
Okay.
But you can decide to proceed to Togo,
all right,
or change your mind and come back to Ghana.
Okay.
So that is where pre-diabetes is. Right. You can change your lifestyle, modify certain things, then you come back into the normal.
So there's hope.
Yes, there is hope.
There's hope.
You can come back.
All right, 23 minutes past the hour of 2 on Joy 99.7 FM. We're still doing recap. Those who were in school last week, Sunday, right? Tuesday was World Diabetes Day or World Diabetes Awareness Day, right? We did a program before that last Sunday, and we're continuing, right? Because we need to get into the serious business of knowing your risk and knowing your response to that risk. Oh yeah, in Afenya, hey, I salute you, Oh yeah, the old school chick, She can jamu. Anyway, yeah, I have evidence, right? Seen a couple more. No, this is not right. Happy birthday, or what is it? To Chief Superintendent Elizabeth Tekubia Dankwa of Kaneshi. Right, I'll get back to those which are to do with diabetes in a sec, okay? If you want to WhatsApp us, 055 11 11 997. We're live on Facebook and YouTube. Okay, so we've understood this, right? Let's explain the random blood sugar. This is fasting blood sugar, right? And we've explained how that is used to conclusively diagnose somebody as diabetic, right? Beatrice, random blood sugar. Which one is that one?
Okay, so random blood sugar is it's different from the fasting. Fasting, you would have fasted for more than 8 hours before we do that. But this one, you've eaten at any time of the day.
At any time
of the day. And usually, if you check the random sugar and it's more than 11.1, then with symptoms, you have to have symptoms. If you have symptoms together with the random being more than 11.1, then we can conclude that you have diabetes.
Okay. Right. You see, you say it so nicely, but still, I'm dealing with my members, Stubborn Academy. Random at any point in time, okay? But definitely not fasting.
Yes.
Right? So, at any point in time, other than after an 8-hour fast, we're taking a dipstick measure of your blood sugar. All right? If we get 11 or more, alongside the presentation of symptoms, right? So with that, we need you. So if you have 11 and you are asymptomatic, doctor is going to look at you, but this is the criteria you use. 11 plus, right? And then there will be, or there should be, symptoms of diabetes that we've talked about. Folks, if you've got any questions, concerns, experiences, share them with us. WhatsApp 055 11 11 997. Yes, I'll do some of the birthday shout outs, but here, Charlie, we are in class, we are serious, we are focused. Okay, these docs, I don't bring them to play. We must be doing serious information given and triggering the transformation that we're talking about. About 2.4 million Ghanaians are diabetic, and they are the ones who know. There's some gray area that is the bomb, the ticking time bomb, that don't know that they have diabetes. Okay, so we are very, very particular about awareness, knowing, computing, calculating, understanding your risk, and using that to transform your response. Any questions, any stubbornness, please send it to me. 055 11 11 997. We're live on Facebook and YouTube, and shortly I will activate the phone lines. Okay, so we've understood that. So at this point, docs, will I be told you are diabetic? And what does it mean when I'm told I am diabetic? Chris.
Okay, so when you are told you have diabetes, it means that we've gone through all these diagnostic criteria that we have discussed, and we have conclusively determined that you have diabetes.
Okay.
We need to be sure of the diagnosis, because diabetes is a chronic illness. When we say it's a chronic illness, it's a lifelong illness.
Right.
And so we need to be absolutely sure before we label you. And what it means is that going forward, you would need to have some dietary interventions, exercise, and then medications. And this is for an indefinite period.
Okay. Unless
you belong to that few small select group where we can have reversal or remission of diabetes, as we discussed the last
So you're immediately, once you've got this confirmed diagnosis, you're going to go into a range of measures or interventions.
Yes.
All right? For an indefinite period.
Yes.
Hey. So could that be for life?
Yes.
So that's your nice way of saying it's like being broke and being financially challenged. So really, seriously, and practically.
Yes. The reason I'm giving a caveat,
right,
and I'm not saying necessarily lifelong, is because of this concept of reversal or remission of diabetes. So for a small group of people, you know, if you lose significant weight, if you make significant changes to your diet, if you exercise, you can reverse your diabetes. But we wouldn't say you have been cured, because if you revert back to your previous behaviors, then the diabetes will come back.
So you are better off in a mindset, a framework that says, hey, it's there. We're doing this seriously. Forever and ever and ever. Right? To keep you well. Okie dokie. I've mentioned the WhatsApp line 055 997. We're live on Facebook and YouTube. We're doing serious business here. So okay. I can't twist you guys. I can't get you to go back and say, oh, the pink sheet was faulty. You can't do a recount, recollation, whatever. I am diabetic. All right. I may or may not have symptoms, but depending on the cutoff, whether it was FBS or what is it, RBS, and so on and so forth. Are these the only measures and indicators used to diagnose diabetes? Is there any other way of telling if a person is diabetic?
Okay, there's something called glycated hemoglobin.
Okay.
Which will check your sugar control within 3 months.
Okay.
If the figure is more than 6.4, it's in percentage.
All right.
If it's more than 6.4, then we can clearly say that you are diabetic.
Okay. So this one is profiling your sugar management or whatever over a longer period. Just in case you think that there was some kululu in the spot check.
Exactly.
This monitors you over time, and it gives you a percentage. And that it is also used to conclusively give you a one-way ticket, which says either you're diabetic or you're not. Okay.
And then the last one I'll add is what we call the oral glucose tolerance test. So this one, we challenge your system by giving a specific load of glucose to see how your body would handle it.
Right.
And then there are also cutoffs that we use to diagnose diabetes.
Okay.
So you don't really need to worry too much about these things. You let it be the headache of your doctor. You know, just report to the facility. Let them take you through the diagnostic criteria. And then confirm it.
2:30, and I'm still in the company of very, very, very senior specialists. Senior physician specialist, Dr. Beatrice Kisiwa. I like the Kisiwa. I know Kisiwa, but Kisiwa has something about it. You see, I like the way you are thinking. Right? She's with the Kolebu Teaching Hospital. Doc is with the Trust Hospitals, and he's also a senior resident in endocrinology. Big things, though. So I didn't just randomly bring them in. They know what they're talking about, and we're talking serious business. Diabetes touches almost every family. Right? Sometimes you are aware of a family history, sometimes you are ignorant of a family history, or sometimes you're just stubborn. Okay? Either way, we're talking serious business, serious numbers. Right. Let me challenge the two of you before we go into the risk and modifying your response. What is the consequence of unmanaged elevated blood sugar? Okay, I'm beyond 7, I'm beyond the 11, all that, whatever percentage. If I don't do anything about it, and generally I feel fine. Life is good. I can sit and, drink, eat, dance, boot for boot with anybody. What's the consequence? What's the big deal?
Okay. Thank you very much, Nortey, for this, because that's where the real problem is. You see, if you have malaria, for instance, you would have fever, you would have headache, joint pains, body aches, and all that, and you would go to the hospital. Okay. But the thing with diabetes and some of these other non-communicable diseases is that they hardly cause symptoms. Dr. Bayer talked about asymptomatic. And in fact, the large majority of people are asymptomatic.
Right.
Those symptoms that we talked about commonly occur in people with type 1. They are in the minority. Just about 10% of patients with diabetes have type 1. The large majority of people with type 2 diabetes, they don't have any symptoms. That's why we encourage screening. When we are screening you, it means that you don't really necessarily have symptoms, but we want to pick the disease before you develop the symptoms. And the reason we are worried is that this condition of diabetes mellitus can lead to a lot of complications.
Okay.
A lot of complications.
Right.
We have what we call the short-term complications or acute, and then the long-term complications.
Okay.
So just briefly on the short-term complications, then I'll let Dr. Baye talk about the long-term. So over the short term, you can have very high levels of blood sugar, which will lead to problems that we call DKA or HHS. I don't normally want to bother people with the terminologies, but just know that your blood sugar can go so high and lead to an acidotic problem, which we call DKA, or there may be no acidosis, but you would have problems with the very high sugars, we call HHS.
Right.
And then also sometimes in the management of the condition, your sugar can go too low. Hypoglycemia, low blood sugar, which is also a complication that we don't really want. So these are by and large the 3 short-term complications, but there are a lot more long-term complications, which Dr. Baye.
What would I see in the DKA? You leave the acidosis out, but what would I see?
So in the DKA, you would pass a lot of urine. You would feel very dehydrated. Your blood sugar will be so high. You may have abdominal pain. You may have nausea, you may have vomiting. It can progress all the way to impaired consciousness and even complete loss of consciousness.
Wow.
Yes, it's a very serious complication that we really educate our patients about and manage them properly to prevent it.
What are the levels we're looking at for this DKA? I'm keeping it at the abbreviated form, but what kind of levels would be associated with the things you're talking about?
Normally your blood sugar will go about 14 millimoles per liter. However, there are a few instances where your blood sugar can still be within the normal range and you will still develop UKA. We call it euglycemic decay. That means your blood sugar is still normal, but you have developed a complication.
Right.
So the other symptoms that I've talked about may be present despite a normal blood sugar, but that is quite rare.
All right.
So normally the sugar will go about 14 millimoles per liter.
So when we are encouraging people check your sugar, and we have all these gizmos and things that now can do it at home and so on and so forth, doesn't it encourage or emphasize a certain fascination, if not obsession, with numbers? But here I hear you mentioning numbers and associated complications or symptoms. Like you're saying, I'm within the normal range, but I'm experiencing X or Y. I should proceed and report to a physician, or
yes. So that's why I always talk about the management being comprehensive. I normally will talk about diet. I'll talk about exercise. I'll talk about education and then the medications.
All right.
Like the 4 legs of a table.
All right.
Which gives it stability. So the education is also very critical. And that's why we are here. So we educate our patients about all these things so that you don't become unnecessarily anxious. And you sit down and check your sugar every hour. And then if the value goes above a certain figure, you are we don't want to create what we call like a distress, or an anxiety within our patients. So the education, we do it all the time in the clinics, and then other avenues, even as we are here, for instance.
Great stuff. 36 minutes past the hour of 2 on Joy 99.7 FM. So you are in partnership, not confrontation, with your service provider, your physician, and so on, to understand and respond to these things we are talking about. This is not just cut and paste academic, or they are not here to brag about what they know. It must translate into the quality of life and the management of this condition we know as diabetes. Any questions, concerns, experiences? Phone line 0302-216541. WhatsApp is 055 1111 997. We're live on Facebook and YouTube, so you can get to ask the question. This one, it says, hi Nortey, is there a side effect of insulin? The body is supposed to produce it needs it to process and unlock the cells. Is there a side effect of insulin? Yes, Doc.
Yes, there is. If you should take so much of the insulin, as Dr. Adai was talking about, it can go so low. Your sugars can go so low. And the low sugar too is not something that we want. You can equally die from that as well.
So you can have an overdose of the insulin.
Yes.
And therefore, its effect is also escalated, and therefore you have significantly lowered or drastically lowered blood sugar, which is not good for you.
Sure.
Right. Anything else? So that is when we are administering insulin.
Yeah.
Can you have an overdose of your own self-produced or manufactured insulin?
No.
Right, you can't.
No. The body regulates that one. Okay. So it is the one that we give you that you can take too much. Sometimes you take too much, or other times you don't take enough food. It's a balance. The amount of food.
You didn't eat as well, but you are still taking your medication or the insulin.
Exactly. So even if you're on the normal dose of insulin that you take every day, but you do not eat and then you take the insulin, then this insulin relatively becomes too much.
Because already it's low.
Because you are not taking enough food.
Right.
And the little blood sugar in there will be pushed into the cells.
Okay.
And then your blood sugar will go low.
Folks, you're hearing this on Ultimate Health, Joy 99.7 FM. It's serious stuff. So you could be under management, but there's something wrong with your management.
Yeah.
And that could also be damaging. Yeah. And you need to be walking side by side with your doctor, your care provider, to understand these things. Phone line 030-221-6541. If you want to ask a question, share an experience with us, we're ready for you. All right. So we've understood those kinds of things. This one says, hello, Nortey. I had an experience of urinating heavily at night. Could urinate about 4 to 5 times. After doing my usual sugar test 2 times, it was below the average one should have. Is there a reason to be curious? Because my dad had diabetes. This is from GK.
Okay. So he said that he's checked the sugar twice and it was normal. Okay, there are other causes of you having polyuria or nocturia. Nocturia meaning you're urinating a lot at night.
Okay.
So what I would advise is that go to a nearby facility and let them check it out for him.
All righty. This one is from Alan. We are so. Do you recommend any herbal treatment? The name is Alan from We Are So Session. All right. He wants to go herbal. Right. We get this a lot. Okay. Our program is broad. We are not biased or prejudiced towards anything. But great question. Herbal. He doesn't say what the herbal does or which herb. He's just asking a generic. Do we recommend anything herbal if a person is diabetic, Doc?
Okay. I would say no for now. You see, the thing with these medications. We are not totally against herbal medications. In fact, if you go to Mampong, there's a plant research into herbal medicine. The whole idea is that we need to add knowledge
and science.
And science. So if you have a particular herb and it has an active ingredient which may bring down your blood sugar, that's okay, but let's subject it to research.
Let's know how much of it you need.
Get the active ingredient and know how much to give.
And be able to replicate it for more than one person.
Exactly. You see, otherwise, when they say, oh, this herbal medicine is good, take 1 cup. What is 1 cup to somebody else? It's like a gallon to another person.
Right.
So there's really no science to it. So for now, I would say that let's go with what is orthodox, what is proven.
All right.
Aha.
Good stuff. All right. So sometimes somebody says, well, my grandfather handed it down to me. I go into the forest, I bring this. I've been treating and curing people for ages. Okay. Then somebody else takes it and it's toxic to them. Right? Are you responsible? Okay. Are doctors in the scientific, should I say, orthodox medicine, they are held liable for what they give you. Okay. They don't mix things in a gallon and sometimes even add some of the orthodox medicines and shake it and say drink it this way. So that is why there's a lot of caution, right? Not should I say bias or prejudice with regard to herbal formulations. Please, for glycated HB, you said blood sugar is monitored over a period of time. Some are done over a period. Is that still are those results still accurate? Did you mention HbA1c? Right. Okay. You see my listeners. They don't joke. Right. So he's saying, if you measure over time, is it still an accurate, valid result?
Usually, when you ask the question, I mentioned the glycated hemoglobin, which is the same as the HbA1c.
That's okay.
So we said that it checks your sugar within a period of 3 months.
Okay. Right.
So usually it's just a test that they will do.
Okay.
But it's checking within the 3 months how your sugars have been controlled within the 3 months.
Then they average that and give you a percentage. Okay.
Yeah.
All right, Chief. I hope you are satisfied. Okay. You sound like somebody who would ask for recounting and recollation. All right. Thank you for the answer. What about long-term injections of insulin? Injecting insulin for 20 or more years. So I'm insulin deficient and therefore I have to have insulin injections. He's talking about long term. The gentleman who asked about side effects, he's been doing this for some time, I guess. Is that going to affect him?
I would say no. You see, we already said that everybody has insulin. Okay. And it is this same insulin that we have studied the structure and replicated.
Right.
So the fact that you've been on insulin for 20 years does not mean. In fact, some people have been diagnosed with type 1 diabetes from the age of 4.
Right.
I have an engineer who is now 55 years, diagnosed at age 4. And he's been on insulin since age 4.
And he's fine.
And he's practicing his profession. He's a fantastic engineer.
And he's managing all the things you ask him to manage.
Yes.
All right.
So that is definitely more than the 20 years. And he has no issues.
Right. So
the side effects are the normal ones we have discussed. Right. If you take too much, you get low. And then one of the other side effects, which we didn't talk about, was excessive weight gain.
Yeah.
Right.
So we choose the people who need the insulin. We balance it against their weight and all that.
Okie dokie, right? So this engineer you're talking about is an excellent example of somebody who knows his risk and knows his response.
Yeah.
Right? He's in serious business and he's benefiting. And indeed, his family is benefiting. Because diabetes strikes down people in their most productive years. And they are gone, right? Or handicapped significantly. And then families are spending money. Charlie, some of these medications, they don't just put a hole in your pocket. They take away the pocket, right? So you need to understand these things and manage them. Good afternoon to you, Nortey, and the doctors. Thank you very much for the education. Linda, I know, so it's been a while, Charlie. You dear, we know you are a loyal Linda. All right. So can we say orthodox medicines work for everybody? Okay, they want to get into this debate then. With the same health conditions, the same medicine doesn't work for everyone in the other orthodox medical field. And why our doctors here don't go into research on herbal medicine but always speak against it? Ike, I disagree with you. Firmly, emphatically. Listen, Ike, if you know the work that goes on at the Mampom Center, right, from Dr. Oku Ampofu, right? It is not true that we don't research, and our doctors, not all doctors must do research, but they harness the research, okay? So if you want to talk about differences or variations in response to medication, I will challenge you to bring the person who did not respond and let's see if their compliance was consistent and whether they were consistently seeing their doctor and so on and so forth. Okay? Sorry if I'm a bit hard on this because I go through these things and we lose people. We lose family members through this kind of debate. When it comes to kidney, the same thing. Oh, I'm doing herbal around why. When it comes to fibroid, I'm shrinking it here. And why, and I'm drinking this. So we've got to be clear. Science just means that it is testable, replicable, and safe. Okay? Yes, there are herbal things that are working. If they are working, we want to know and make sure it works for everybody. Docs, any response to this? Other than what I've said?
I think you said it. And I mean, the center at Mampong, speaks to it.
They do so much marvelous work.
Yes.
Marvelous work. All right. Okay. And thumbs up to the guys there. I'll bring them in one of these days. Years back, they used to come pretty often. Right. But I get your point. Okay. But there are lots of people who are not compliant. I am the president of the Stubborn Academy Association. And so we know why we're an association. People will not take, they'll go and eat this, they'll sing alongside people. My thing has come, this, that. But they knew. Okay? That's why we say know your risk, know your response. So sometimes, there are people who also don't do so well on herbal. Yeah. Okay, whether you bought it in a bus or a trotro or Yutong bus, right? Same thing. Okay, good stuff. 46 minutes past the hour of 2. Okay, so Doc, thank you, boss, for your answer. Who's this one? All right, we're here for you. Okay, that's why we come in on a Sunday. Alan from We Are So Seshri. All right, great stuff. Okay, any more questions, concerns? You can call us as well. Oh, we like to do good business. Right, so Docs, so we understand some of these things. All right. Last week we learned that some of these things, especially when it comes to type 2, are due to modifiable factors or should I say modifiable risk factors. I'm reticent to say cause or causative agents.
Yeah, right? Risk factors
is better. It's better, brofu. Yeah. Okay. So these things we can modify. Let's go into them again because that's part of the response, right? So there are some of the things that can tip you into diabetes. You will be diagnosed, emphatic, conclusive, They say you may be put on a program that is indefinite. Nice way of saying lifelong, right? Okay, so what are some of these lifestyle things we can change?
Okay, so first of all, our lifestyle, that is our diet. Then obesity, our weight. Weight.
Okay.
We need to lose weight.
But some of the weight is fine though. I'm looking at you. I'm looking at Chris too. Him. We have some moderate polytank in the right areas. Something to have and to hold. Not so. Yeah. You must be holdable. Yeah. But when you say weight and things, you can modify it. Give us some guidance. Last week he brought in the BMI. All right, so give us some guidance, Chris.
Okay. So the issue of weight again. Yes, we use the body mass index as a rough estimate. It's not the only measure of obesity.
Okay.
But by and large, the heavier you are on the scale, the more likely you are to develop diabetes.
Okay.
That one is an established fact. We are not saying that everybody who is obese has diabetes.
Okay.
Neither are we saying that everybody with diabetes is obese.
Understood.
Yes, but it just increases your risk.
It's a marker.
Right. And once something is a risk factor, it means that when you deal with it, you can reduce your risk.
When you deal with it, you're in good business.
You are in good business.
All right.
So just as we are saying, know your risk, know your response.
Right.
So if you know obesity or being overweight, it's a risk factor for diabetes.
All right.
Then if you take appropriate measures like your diet, exercise, and then together you lose weight, then you reduce your risk. And that is why even the remission of type 2 diabetes that I talked about, I have a young lady who used to weigh about 120, 125 kilos.
Okay.
And then she went on a serious dietary and exercise regimen.
All right.
Now she weighs about 85, 90 kilos. And she has gone off all the medications and her blood sugar is normal.
Okay.
So that is the remission of the type 2 diabetes that we are talking about.
All right.
But if she should relax and get the weight back on, the diabetes will recur. That's why we don't talk about
all right. Okie dokie. Right. So you can be doing all the dance challenges and shaking all sorts parts of your body, but we want you to be healthy. If you are oboloish or well covered, as they say, well covered and rounded and curvy and all that, that's fine. But are you healthy? Those are the critical indicators we are measuring and talking about. I comes back again and says all the orthodox medicinal properties seek to imitate plant or herbal medical properties which occur naturally. Ike, I have your number. I'm coming. Get me a cold bottle of club beer and we shall debate. Meanwhile, the club will break down and then it will cause some things. But I get your point. I know where you are going. But the same way you say doctors or orthodox doctors are biased, I sense your bias. Or am I right? He says the medicines are pretending to be plants. The source of these medicines, of course, there are artificial or manufactured medications, right? But it's based on science.
Yes, you see the whole idea. It's not bad. If, for instance, when manufacturers produce these baby foods, we know that breast milk is the best for a baby.
Yeah.
But it's not everybody who can breastfeed.
And thank you. We say it is the best.
Yes, it's the best.
Right.
And so if for those people who cannot breastfeed, what we do is that we study the composition of the breast milk and then we make something which is similar.
Bless you, brother.
And then for those who cannot breastfeed, they have an alternative.
There's an alternative.
That's it. Right. I don't think we should split heads over this.
And essentially, I bring the doctors into the studio to do this education and awareness to actually essentially and ultimately put them out of work. Yes, they would like the numbers they see to drop. Okay, so we are in the same business. Right? It's not as if they want you to have diabetes and they will lie to you so that you'll be coming and so on and so forth. Of course, I can do the big pharma argument as well. Right? But let's understand it. We had the same argy-bargy when it was COVID. How come they produce the vaccine so quickly? Will we take it? Should we take it? Right. Okay. Please, is there a relationship between cholesterol and diabetes? This is from GK again. Right? Great questions.
Okay. I remember just this Friday, Dr. Adai gave a talk and he mentioned about the Trinity.
All right.
Where the Trinity is there, your blood pressure, that's hypertension.
Okay.
Then cholesterol and the sugar.
Okay.
So they are related.
They are related.
Okay. Then they are usually together.
Okay.
You can start with one, eventually the other one shows up and the other.
Okay.
So
they are related. Okay. Hypertension, cholesterol, diabetes, and then diabetes too can go and pull the rest, and then hypertension can pull the rest, and very soon you are in very bad business. So when you hear the doctors talk about the Trinity or the triumvirate, please,
the unholy Trinity,
you don't want them. It's an unholy fellowship that you don't want. Okay, and when we see those combinations, typically sometimes the outlook or the prognosis is not that good. Right, that's why we need to talk aggressively about these things. As soon as we allow gray areas, ifs and buts, then people feel they don't need all this talk anyway. Right? They'll wait for Nortey to do it again next year when it's 14th of November. Good afternoon. I take bitter leaves and bitter melon gourd juices. Can these be termed herbal? Mafio inosu. Oh, mafio. Bitter leaf, bitter melon. Gourd juice. The person is going into. Are you taking them as a treatment? Is it your preferred juice or diet? Are you making any therapeutic claims after taking them? Or doctors, am I wrong?
You're absolutely right.
Because she tells me she takes them. She doesn't tell me she's taking them to prevent or cure anything.
Yeah, these are fruit.
And then she throws the question at me, can they be termed herbal? Right.
They can be termed dietary. Let's just take it as diet. You see, if you say that something is medicinal, you must prove its efficacy in a well-conducted trial.
Okay.
And then as you prove the efficacy you must also demonstrate that it is safe. Okay. It doesn't cause harm.
All right.
And that's why there's Food and Drug Administration.
Right.
You know, when you say that this is a medicine, they will subject it to strict proof. That it does what it says it does, and it is not harmful.
Right.
Don't forget, some of these medications, they damage your liver and they damage your kidneys. So when we are prescribing medications for you, we know what it can do, and then we monitor you.
Great stuff.
You know.
Okay. So Mafio, Charlie, drink on, no, Charlie. If you want to link it to gains, then you are entering the realm of claims that must be verified, at least proven. Then me and Chris and Beatrice can come and join you every Sunday afternoon, and we'll drink bitter melon. All right? Okay. If you want also to suggest or inquire, would it be helpful in preventing diabetes or managing my blood sugar? That's also another question which must be verified properly. Right? But I like your concoction, It's good. Very soon people will be sending their concoctions. Right. Many biochemists and pharmacists out there. Good afternoon, Nortey. I was diagnosed with diabetes and given GR metformin 500 milligrams. I stopped taking it because anytime I take it, I have a headache, stomach pain, chills, etc. What should I do now? This is Bafwa from Kolebu. So he has stopped taking it. Okay. GR metformin. What is it? What is it for? Does it cause these things he's talking about? And what advice do you have for Bafwa?
Okay. So Bafwa, yes, you said you took the metformin. Yes, some of the side effects. Some people come and report that when they take the metformin, they can have the pain, they can have diarrhea with it. Okay. So what we advise is that there are other medications. If you are not tolerating the metformin, it doesn't mean that you should stop and stay at home.
What does it do, my dear?
Metformin is one of the drugs that we use in type 2 diabetes to reduce your sugar.
Okay. So it's helping you manage your
sugar.
It is not insulin.
It's not insulin.
Right.
It's not insulin.
Right. Okay.
So, for our advice that you go back to your doctors and tell them that this is what happened when I took the metformin.
Okay.
There are other medications that can be used in place of the metformin as well.
Meaning those alternatives will be doing the same thing.
Yes.
But may not come with the same associated effects you, Bafwa, are experiencing. All right. Because other people are on metformin and they're fine. Okay. Great stuff. So, Bafwa, please, since you are in Kolebu, please talk to them or go there or talk to your doctors. And good morning, Nortey and team. We're in the afternoon. Please, are the values supposed to be the same for children? Okay, if we're diagnosing the cutoffs, are they the same for children? That's a good one. 2 times I have tested my kids and their values were above 6. I was told I should not be worried because they might have taken some beverage in the evening, usually around 8 p.m. So are you observing, is it a fasting blood sugar? What were you doing with the kids? But they're asking, are the cutoffs the same for kids? This is from Kwame. Thanks for sharing, Kwame.
Yes, generally I would say yes. The people who have a different cutoff values are the pregnant women.
Okay.
Right. But generally for children and adults, yes.
Okay. Right. The same cutoff.
Yes.
Meaning that the same processes are being measured. So if it's fasting, minimum of 8 hours for children as well.
Exactly. So yes. Okay. So maybe it wasn't a proper fasting.
Okay.
We need to be sure. And then if it's abnormal and we don't really know, sometimes we do the challenge. Okay. The glucose tolerance test that I talked about. Okay. So that I challenge the system.
Okay. Yeah. Right. Thanks for sharing, Kwame. Hello, senior boy. Hey. This one's a senior boy. All right. Okay. I like the boy part. To be confirmed as diabetic, are these tests necessary? Fasting, insulin level, and C-peptide. My name is Kobna Dazi. Okay, I salute you. Okay, it means you went to one of the schools I went to, but senior boy sounds like infancy, man. I salute you. So he's bringing in another angle, right? Are these tests required or necessary? Fasting, insulin level, and C-peptide.
Okay, so this is one of your postgraduate students of the Ultimate Health Academy. Yes.
He's on point then.
Yes. But I would say that we don't do this for everybody. Okay, by and large, we are able to tell type 1 from type 2. But there are a few instances where you aren't too sure.
Okay.
Then you can do this test to help you distinguish between type 1 and type 2.
All right.
Yeah.
So it's higher level. He's gone from 3G, 4G to 5G. Yeah. And he says he's Kobna Dazi, and he says I'm Koba 97. If that was mobile you were typing and KK, please kneel down or stoop wherever you are. Great. Thanks for sharing. He's written mobile. You see why we are struggling at science and math schools. Mobile. Okay, so sometimes higher level or more advanced tests may be done if required.
Yes.
But for the basics, we've done the due diligence.
Yes.
All right.
Yes.
Okay, so we're about wrapping up. He says he takes the bomaze. Bomaze means bend over and be whacked or thumped in the back. So when a senior tells you bomaze, then you know you're going to receive it. All right. So, knowing your response is alongside the professionals. So if they ask you to diet, you must know what you're doing and do it diligently. Right? You gave me a kind of a calculator. I put it on my status, and Abeku will share that on our pages as well. Okay. Right? So I would believe or want to believe that it gives you one-stop computation where you fill in all your symptoms, your body mass index, and all those things. Is that what it is?
Yes. So you see, we've talked about the risk factors over and over. So what that calculator simply seeks to do is to give numerical value to all those things. So anybody can go online, diabetes risk calculator. You get it. They ask you some questions. Some of it 8 questions, others 11 questions. It's on these things that you talked about. Just put them in. It will give you.
Put them in honestly.
Yes, honestly.
Okay.
And then it will give you a figure, and then tell you that your risk is low, your risk is moderate, your risk is high.
So Beatrice, risk is not diagnosis. It's just computing your risk.
Yes.
Right? So you don't do this thing online and say, okay, I am not diabetic. Right? It gets ways and computes your risk based on the variables it asks you to input. Okay. Would you recommend that everybody should at least do that and get a sense of risk and then also proceed to the professionals?
Oh, sure. It's helpful. We've talked about the risk, and sometimes we debate it. Oh, obesity, oh, this, oh, that, oh, that. Just put the values in. You will get an absolute figure. I did my own. I had moderate risk. And yes, so I know that.
You the doctor.
Yes.
You are moderate.
Diabetes is no respecter of anybody.
I will not check my risk. Beatrice, you are also moderate. We have to check our risk. The doctor himself is moderate. Okay, last question. We are over time. Nortey, one more question. It says, anytime I'm feeling hypo, that's the blood sugar has gone low, and when I check my sugar level, it's always between 6 to 7. Right? Is there anything wrong with me? This is Bob Cote, right? He's asked about the effect of long-term injection of insulin and all that, side effects. But he says there are times, I think he knows what hypo is, right? Can we quickly hit that for Bob Cote? Bob, thanks so much for sharing. All right? He feels what he should feel when he's hypo. He has low blood sugar, but when he checks, it's between 6 and 7.
Okay, so this would be a condition we refer to as relative hypoglycemia. Relative. Okay. You see, when we say hypoglycemia for somebody with diabetes, it means that your sugar is definitely below 4 millimoles per liter.
Okay.
And then there are certain trigger signs. Okay. You may have dizziness, palpitations, you will feel confused and all that. So it's the symptoms that he's talking about. Okay. But it's not every time that when you have those symptoms, your blood sugar is actually less than 4. Right. So in his case, he may be experiencing the symptoms which are suggestive of hypoglycemia. Okay. But when he checked the sugar, it's above 4. Okay. So it's not hypoglycemia, but it's relative hypoglycemia. So
what should he do? Because sometimes they're instructed to take something and this, that. What should he do?
Yes, so when you are not able to check your sugar at the time, it's good to assume it's less than 4 and then do something. Okay. Take something. Right. But if you check and it's definitely above 4, you are safe. Right. What you need to do is to get back to your doctor, because this condition normally occurs when your blood sugar control has been poor for some time. Okay. And then we are trying to bring you down quickly. Okay. So your sugars were in the 14, 15, and then all of a sudden somebody's trying to bring you down to the normal. All right. You may feel these things. Okay. So you just slow down the rate at which you get to the normal levels.
Right. Great stuff. Bob Cote, thanks for sharing, and thanks to you, all my discerning listeners, and Doc Beatrice and Doc Chris. We are grateful. I'm hoping that people will take heed. Those who are not diabetic, they should continue doing what they are doing. That has protected them. Those who are diabetic, please, the things you've been asked to do or take, please take them. If you have any challenges, go back to your prescribers, your managers, and make sure you are getting the benchmark outcomes that you're supposed to. Quality of life is important. Even before all this IMF and debt restructuring, people had diabetes. So please, let's be sure. Thanks once again, Dr. Bayer and Dr. Adai, for sharing with us. Dick and stay on Joy 99.7 FM. My name is Nortey by Nature, produced by Abeku Sankofi. Dick and stay. I'm out.